Welcome to our presentation on GLP-1 receptor agonists in clinical practice, presented by Dr. Adebola Adetuloye. This session will explore the role of GLP-1 receptor agonists in managing conditions like diabetes and obesity, providing insights into their mechanisms and clinical applications. Our learning objectives include understanding GLP-1 physiology and pharmacology, identifying indications and available agents, explaining mechanisms of action, recognizing contraindications, and discussing adverse effects. These objectives will guide our exploration of GLP-1 receptor agonists. GLP-1 receptor agonists were discovered from Exendin 4 in Gila monster saliva, with the first approval in 2005. These synthetic peptides mimic GLP-1 and resist DPP-4 degradation. They are used for type 2 diabetes, obesity, and are being studied for other conditions, offering benefits like weight loss and cardiovascular protection. GLP-1 is an incretin hormone secreted by intestinal L cells. It enhances insulin secretion, inhibits glucagon, slows gastric emptying, and promotes satiety. Degraded by DPP-4, GLP-1 plays a crucial role in glucose metabolism and appetite regulation. GLP-1 agonists are synthetic peptides that mimic GLP-1 and resist DPP-4 degradation. Types include exenatide, liraglutide, dulaglutide, semaglutide, and tirzepatide. These agents are pivotal in managing diabetes and obesity, offering diverse therapeutic options. FDA-approved uses for GLP-1 agonists include type 2 diabetes mellitus, obesity, and weight management. They also reduce cardiovascular risk and offer benefits for atherosclerotic cardiovascular disease. Off-label uses include NAFLD, PCOS, and prediabetes. The mechanism of action for GLP-1 receptor agonists involves increasing insulin and decreasing glucagon. They enhance insulin sensitivity, reduce gluconeogenesis, slow gastric emptying, and promote satiety. These actions contribute to improved glucose control and weight management. Comparing GLP-1 receptor agonists, we see variations in route, dosing frequency, half-life, weight loss effect, and cardiovascular benefits. For instance, semaglutide offers high weight loss and cardiovascular benefits, while tirzepatide shows very high weight loss effects. Beyond glycemic control, GLP-1 receptor agonists offer benefits like weight loss, cardiovascular improvements, and potential hepatic and renal benefits. They also provide neuroprotective effects and may benefit obstructive sleep apnea, broadening their therapeutic impact. Cardiovascular benefits of GLP-1 receptor agonists include reducing major adverse cardiovascular events, lowering stroke risk, and improving blood pressure and endothelial function. They also improve weight, lipids, glucose, and inflammation, with minimal hypoglycemia risk. In weight loss comparisons, GLP-1 agonists like semaglutide and tirzepatide show significant reductions. Semaglutide achieves 10 to 15% weight loss, while tirzepatide reaches 15 to 22%. These results highlight their effectiveness in managing obesity alongside diabetes. Clinical trials like LEADER, SUSTAIN-6, and SURMOUNT highlight the efficacy of GLP-1 agonists. Liraglutide reduces cardiovascular events, semaglutide lowers major adverse cardiovascular events, and tirzepatide significantly reduces weight, showcasing their therapeutic potential. Contraindications for GLP-1 receptor agonists include a history of medullary thyroid carcinoma, MN2 syndrome, pancreatitis, pregnancy, and severe gastrointestinal diseases like gastroparesis. These factors must be considered when prescribing these medications. Common side effects of GLP-1 receptor agonists include gastrointestinal issues like nausea, vomiting, and diarrhea, as well as CNS effects like headache and dizziness. Hypoglycemia can occur with insulin or sulfonylureas, and injection site reactions are possible. Serious adverse effects of GLP-1 receptor agonists include pancreatitis, gastroparesis, intestinal obstruction, gallbladder disease, acute kidney injury from dehydration, and thyroid tumors in rodents. Monitoring and management are crucial to mitigate these risks. Managing adverse effects involves starting with a low dose and titrating slowly. Patients should consume small, bland meals and maintain hydration. If pancreatitis symptoms occur, discontinuation is necessary. These strategies help minimize side effects and improve tolerance. Drug interactions with GLP-1 receptor agonists include delayed gastric emptying, affecting oral drug absorption. Hypoglycemia risk increases with insulin or sulfonylureas. Avoid combining with DPP-4 inhibitors due to increased pancreatitis risk. Initiation and titration of GLP-1 receptor agonists should match the agent to the indication and patient preference. Weekly agents improve compliance. Start with a low dose to minimize GI side effects. Restarting after interruption may require beginning at the initial dose. Dosing for GLP-1 receptor agonists varies by drug. For example, exenatide starts at 5 mcg BID, while semaglutide begins at 0.25 mg weekly. Titration intervals and target doses differ, emphasizing the need for personalized treatment plans to optimize outcomes. In summary, GLP-1 receptor agonists are effective for type 2 diabetes and obesity, reducing glucose, weight, and cardiovascular risk. Monitoring for adverse effects and personalizing therapy are essential. Start with a low dose and titrate slowly for optimal results.